And welcome back. It's estimated 1 in 8 women develop breast cancer in their lives, making it one of the most common cancers among women living in New York and New Jersey. RadNet is the national leader in outpatient imaging that recently initiated a service allowing AI to detect breast cancers. Joining us now to tell more details is the medical director of women's imaging at Delaware Imaging Network, Dr. Jacqueline Holt. And we thank you so much for joining us, Dr. Holt.
Thank you for having me.
Thank you. And the conversation of AI and breast cancer, it's been on the minds and really on the mouths of many people recently. Talk to us about the correlation of AI and breast cancer.
Okay, well, as you probably know, reading mammograms is complicated and difficult because there's a mixture of densities in there, dense tissue, fatty tissue. When you apply an artificial, I'll call it an algorithm, but using artificial intelligence that was trained on literally millions of images, thousands and thousands of cancers, more cancers than anybody could actually see or diagnose in their lifetime. And you apply that to a mammogram that is read by a breast specialist radiologist, you can find more cancers, and also decrease your false positives or the callbacks because you're adding this computer. So if you add an artificial intelligence, you can pick up more cancers because the artificial intelligence was trained on thousands of cancers, more than anybody could see in their lifetime, and you increase your cancer detection in women. And as you know, the sooner you find a cancer, the more survivable that cancer is. If you find a cancer in stage one, the chance of survival is 99%. And even in stage two, it's close to 90. So a lot of effort goes into finding these cancers as early as possible and adding an artificial intelligence to that
Yeah.
increases survival.
Well, Dr. Holt, I know you have a new program that's out there, a new pilot program that's really dealing with this. So, can you share with us a little bit about the pilot program and how it works?
Okay, so it's called EBCD. It's our enhanced breast cancer detection. And a woman would come in, and in some ways, it's invisible to them. We have the highest resolution equipment, and I don't just mean 3D mammogram. I mean the HD, highest quality mammogram on the market. And that's at all of our sites universally. And the AI is applied to the mammogram. It goes through the system. It only takes maybe a couple of minutes for that algorithm to be applied. That can show cancers that the human eye could potentially miss. Um, and it adds the chance of finding a cancer. And we also have a additional reading program if there is any discrepancy. In other words, if the artificial intelligence tells us that there's a higher risk, and the mammogram was read by expert radiologist as we have a second read system in place if there's a discrepancy between what the AI is telling us, if they want us to take an additional look at that.
And so you're empowering women to take control of their health, and I think this is one of the ways that possibly, they can do that, taking advantage of this. Um, for someone who may still not understand it and have some questions, put away some of the possible, challenges that they may have mentally about going through something like this.
Well, it's really just a better mammogram, or let's say the very best mammogram that is available on the market. And we're actually quite lucky to have this uh, type of technology. 10 years ago, we weren't even anywhere near this, and we have one of the few FDA approved artificial intelligence on the market, and for us to have it deployed and in the Bronx and elsewhere in New York and LHR sites is really the best thing that a woman can do for her health. And I personally wouldn't want my mammogram to not have artificial intelligence applied, nor would I recommend it, or would I want a family member to not have this advantage if it's available. So it's the very best mammogram that one could get on the market now.
When you talk about detecting breast cancer and those numbers, give us a little background as to, have you seen an increase in being able to detect and what this has been like for you?
Well, we have found, and this is very interesting, with using the artificial intelligence and also our double reading system. We have actually found hundreds of cancers. It's been a few hundred cancers that would not have otherwise been found, and these were read by expert radiologists, either fellowship trained or spent their career reading mammograms. But as our FDA article that when we applied for the FDA proves that all radiologists are helped by using this artificial intelligence. The very expert, and in some parts of the country, there are radiologists who don't read the volume as we do here, and they are helped to a greater degree. And it sort of brings that cancer detection level um, as high as it can be for all readers, and it makes a very uniform quality. So we have found cancers, and that's always astounding to me when that second reading comes, and I can see that that's a cancer that would not have otherwise been found. And partly that is because the artificial intelligence was trained not only on thousands and thousands of cancers, but also cancers that we went to the year before the mammogram where it was actually found, and then it was trained on those mammograms. So we're really harnessing the computer along with the human to find the cancers as early as we can.
Yeah. Well, Dr. Jacqueline Holt, we have to leave it there. And so thanks, Dr. Holt, for being with us, and continued success on the work that you're doing.
Thank you very much. Appreciate it.
All righty. Well, for more information, you can visit the website at radnet.com and then follow them on Facebook at Radnet Inc. We encourage you, don't go anywhere. We'll be back with more Open coming up right after this.